Oh, what a beautiful day it is, a nice day this morning. I hope anybody go to that Refresh Leadership last week. Wasn't that a good workshop? And it was free except for, I believe, the lunch. I couldn't make the lunch, but I think the morning program I was able to attend, and it was really a good program. But my name is Dr. Robert Twaddell. Next year will be my 20th year here in Fayetteville. I graduated college of chiropractic outside Chicago. I purchased down in chiropractic, had a couple name changes and things like that, and named my clinic A Healthy Back. About 10 years ago, I started using laser therapy in my clinic. It's a new therapy, helps with pain management and things like that. I brought my pain management laser with me. I did maybe do a demonstration on my knee and tell you how wonderful it feels. If anybody has like a knee injury or something and want to try it, maybe we'll if we have time later today, I can kind of demonstrate that and things like that. Ankles, wrists, shoulders. Anybody have injuries or anything like that, knee? Maybe we can share with you a little bit of laser therapy. But 3 years ago, the company approached me and asked me to do a study on laser therapy for body contouring. It's not the iLipo, it was called Contura. And so we did a little research with that. My patients had fairly good results. The procedure lasted 45 minutes. It was very demanding, placing these small little pads. They're about the size of this. This is actually an iLipo pad for like the chin and things like that. But there were so many different lasers. We had to place it in many different ways. About a year and a half ago, I purchased the iLipo, and it's the #1 alternative to liposuction. We'll kind of learn a little bit about that. The company name is Chromogenics that made the iLipo laser. They have over 5,000 different kinds of lasers. They started off with hair removal, laser hair removal. Now they're getting into some advanced acne treatments. So, let's see. The iLipo is basically the best alternative to liposuction. Won many beauty and body contouring awards. It's out of Europe, and so there's a lot more advanced in laser than we are here in the United States. We'll talk about the mechanism of the laser in just a moment. The triglycerides inside the fat cell is really what the target is when we're breaking down the fat. The pads are very broad, and there's over 40 lasers that are being approached, that are being used to break down the fat. The patient lies down comfortably, and we strap down 4 of these laser pads on the treatment area. It penetrates through the skin. They told me to stand over here, I guess. So a certain area. It penetrates through the skin and stimulates the subcutaneous fat area. The subcutaneous fat is really the only part of the body that basically breaks down the fat. It doesn't go down into the visceral fat or deeper fat, things like that. But right underneath the skin is the target area. The laser is absorbed by the fat cells, and it breaks down the triglycerides and the fatty acids. One of the things I forgot to mention is I have a book. I wrote a book. Can anyone tell me for a book how many fatty acids there are in a triglyceride? I just mentioned it. Huh? 3? You were right. Here you go. Try meaning 3 fatty acids in a triglyceride molecule. Okay, so it breaks down the fat, triglycerides, and it basically kind of floats away in the lymphatic system, kind of like changing grapes into raisins. It empties the content of the cell and shrivels it up. Less area to see. You can see it on MRI, circular fat cells, and after 6 minutes of laser exposure, the fat is completely liquefied and collapse the cell. The lymphatic system is also important. We see the inguinal lymph nodes here. We actually apply laser to that area too if we're doing the abdomen or thighs area. 90% or more, the treatments is in the abdomen area. Abdomen, love handles, bra fat area. Second area is thighs. It's evidence-based. A lot of research has gone into it. If we measure 3 areas across the abdomen, average loss is about 6 centimeters. So that's almost an inch with each treatment. I tell patients that we see about a half an inch to 1 inch loss. I've seen as many as 2 inch loss with a single treatment. A typical patient loses abdomen fat, slimmed down. These are measurements. We went from 115 to 103 after 8 visits, loss of 5 kilograms, reduction of fat 39 to 35%. You can see the fat change, decrease, 2.35 to 1.6 in ultrasound, and just a bunch of pre and post measurements. This is a slide of fat, remember biology and things like that. Here you see the fat cells before treatment. This is the fat cells after treatment. I was told I had 6 minutes. What I'd like to do is show you a 2-minute video. Use my last 2 minutes with the video, and then I'll answer any questions you might have. Let's see here. Oops. There's a lot of research on, or a lot of videos online. This 50-minute video shows the doctors, Dr. Oz, Ricky Lake, morning shows, all the different shows that have featured the eye lipo. But here's a 2-minute video showing the procedure, and kind of let you share that.
Welcome to a revolutionary new technology for non-invasive fat reduction and body shaping. iLipo is the intelligent alternative to liposuction. iLipo is a revolutionary treatment for non-invasive fat reduction and body shaping with up to 4 centimeter inch loss after every treatment. Now you can achieve the results of liposuction without surgery. iLipo incorporates over 32 advanced lasers which safely penetrate the skin and are absorbed in the fat cells. This stimulation opens pores in the fat cell wall and breaks down the fat cell contents, allowing fat to escape through the pores. The fat cells then shrink and collapse, and the excess is then safely removed by the body's natural metabolic process. During your treatment, you simply lie comfortably on the treatment couch. Your therapist will place the laser pads for 10 minutes on each treatment area. A course of 8 treatments is recommended over a 4-week period. You may feel a gentle warming sensation as the laser works to release fat. After each treatment, exercise is recommended to accelerate the removal of released fat from the area. You can then return to normal daily activity. It's that simple. iLipo can achieve significant inch loss, and with a sensible diet and exercise program, these results can be further enhanced and maintained. iLipo is safe, affordable, and helps to improve your health and well-being for years to come. For more information, ask your therapist about how iLipo can help you achieve the shape you desire.
All right, so with each treatment, for another copy of my book, I wrote this book last year, talks all about our different therapies for back pain, including laser therapy, chiropractic, spinal disc decompression, and acupuncture. For another copy of my book, How Many Inches Can You Lose in One Treatment?
You've seen up to 2 inches.
Up to 2 inches, usually typically about a 1 inch loss. Oh. All right, my 6 minutes is up, I think, but if anybody has any questions, I'd love to make it a little bit more interactive. Yes?
Is there any side effect?
No side effects at all, unless you're pregnant.
Well, I've got to check on that.
There's really no contraindications to the treatment except for pregnancy, cancer, and a couple other things that are usually very rare that we see in that clinic. The body areas that we can treat are nearly everything except for female breasts for liability reasons and the effect of the treatment on that. We don't do that, but everything else supposedly you can treat. Yes.
Again, does the insurance company pay?
The insurance company does not cover any of our laser therapies, whether it's pain management or body contouring. We are offering, some discounts and things like that. If anybody in this room would like to give it a try, I'll do 2 body areas. I handed out our pricing for $95. So it's our price for a single area. One session, single area, $95. I'll do 2 areas for $95. Plus a little other discount on the package. We offer like an $800 discount, as you can see, on a package of 8, or we do 0% financing with care credit.
What happened to the fat you bust open?
The fat gets broken down, okay? It gets broken down by the laser into the smaller fatty acids. The fatty acids, I tell patients, are more like oils, so it's not a solid fat, and they float around in the lymphatic system. And we usually ask patients to do about 20 to 30 minutes of exercise immediately following or within 2 hours of treatment. That will allow the body to use those fats that are floating in the lymphatic system. So it basically gets broken down in the lymphatic system in your body.
So it's metabolized?
Metabolized. Yes.
What happens to the cell membrane?
The cell membrane is usually intact. The laser actually punches holes into it, but it is intact and it's not killed.
So it can rehydrate?
It can rehydrate or regenerate if you go to Dunkin' Donuts immediately after. Yes.
Yeah, I do. What happens, how long does that stay? Like, if you, after the treatment?
Basically, it's based on compliance.
Okay.
Patients who are motivated to keep the fat off and stay away from McDonald's and things like that, do a little bit of exercise, usually gives good results.
Do you have a diet or treatment plan for folks?
We do have a little bit of a diet recommendation that we do provide patients. Breads and pastries usually don't help. Basically, there's a lot of people have recommendations of that, what you should and should not do, and we kind of suggest listening to some of that. We kind of follow a lot of the guidelines that are out there, and don't make people buy my food, things like that. Yeah.
Is there a particular exercise regimen?
We have actually an elliptical machine in our office as well as a recumbent bike. But many patients, military and other things have gyms that they like to go to on their own. But we really see a difference for those who do exercise within that 2-hour block immediately afterwards.
So
and drink lots of fluid.
Treadmill, elliptical?
Treadmill, elliptical is fine, yeah. Yes.
I compare it to the frozen treatment.
Okay, frozen treatment? I wish I brought a picture of that frozen treatment. The frozen treatment, I don't even know if they still offer that here in Fayetteville. I don't see a lot of advertisement. They used to have it.
They used to come in Gold's Gym.
Gold's
They
Gym.
used to show up, they had demonstrations.
Yeah, I wonder if they even offer it anymore, because I haven't seen much promotion like that. Dr. Dickerson used to have it in his clinic. But basically what that does is it grabs a bunch of the fat, or it grabs as much fat as you can, deep freeze it, and it's as solid as butter. You know, so it's, you know, kind of freezes that skin, and over the next 3 months, it breaks down the cells. You don't get immediate results. It's very painful, as you can imagine, deep freezing your skin. And the treatment above and below that fat is not treated. Whereas our treatment is, you know, you have 42 lasers. We can position, you know, different areas and target the fat cells. And you can see on the videos on your own, Dr. Oz regulates the demonstrations and things like that. And they have before and after pictures, and very effective. Yes?
I know you said that, you know, if there is contraindications for cancer, but what about people who have had things like types of lymphoma who are now in remission? Because you said that it is metabolized through your lymph system, so I'm just curious.
Yeah. We haven't seen a lot of that in our clinic. We kind of would talk about that, you know, individually. Yes?
Are there certain types of pains that are more, that this type of therapy works better for?
The pains? The laser therapy actually helps mostly with soft tissue, tendinitis, bursitis, as well as inflammation. Sometimes degeneration, bone degeneration or osteoarthritis is helped because the tissues around it get inflamed. Does anybody, do I have 5 minutes to do a little demonstration on that? Does somebody want to give it a try?
I have osteoarthritis.
Osteoarthritis, is it a little painful?
Yeah, a little.
A little? Come on up here, let me show you our laser for our pain. This is a radial laser, again, it's Swedish technology.
Way ahead.
I don't know. And because we have direct contact, the laser would damage eyes, but I don't usually have patients wear goggles because it is flush with the skin and things like that. So it's completely, there's no scatter and things like that. So have you had treatments before on that?
I've had the, well, you have to have the cortisone.
Mhm.
I had the booster shots and
Okay.
2 times already.
And that's been more than 2 weeks ago?
It's been a year.
Been a year ago?
Over a year now.
And on a scale of 0 to 10, how's your rate of pain right now?
Right now, when I'm in this position, nothing's happening, but if I have to get up and down,
Up and
I'm
down?
gonna feel it, yeah.
Okay.
It's really
So
bad here, but
getting up and moving over here,
I felt
you
it.
felt?
Oh, yeah.
Okay, so where is it mostly?
Hurts.
Hurts.
Right there.
Right in there. There, want to push that in there?
There it is.
There it is.
There it is.
Ding, ding, ding,
So what
ding.
we want to do is just, I'm going to talk with them, and
Okay.
just go ahead and hold it.
Okay, second noise.
It's going to beep a little bit. Tell me it's on and things like that.
Right.
And moving around that area slowly, you can hold it there for 10 seconds and move it around and things like that. And I'll answer any other questions that you might have.
Let's talk about back treatment.
Back treatments, yes.
Lower back, bulging disc, pains radiating into the legs.
Oh yeah, sciatica and hanging out. We do a couple different things. Chiropractic, which is moving those joints, freeing those restrictions and things like that. One of the common things for disc bulging, and where some of that disc material comes out, is actually our disc decompression. That actually separates the bones, and that disc tends to kind of go back into that disc area. The laser therapy would help reduce some of that inflammation, pressing on that nerve that is sending pain signals down the leg, so it's very, very effective. A couple years back, actually, the newspaper, 10 years ago or so, the newspaper actually did an article, and we helped several patients. But recently, it's been helping quite a bit of patients with the laser therapy. Thing is, people just don't know about it, and so that's what I'm looking for is, just telling people people about our laser therapy and things like that.
So you use that machine
Use that
on the
machine.
back?
Mhm.
Okay.
Are you like the only ones around here doing this?
There was another doctor on Bordeaux Shopping Center, but I think he got in trouble with the law with medicines and things like that. Yes?
I imagine you get a lot of business from the military.
We get some. We get some.
Fort Bragg tends to be a center in the Army for orthopedic injuries. I mean, jumping out of airplanes,
Yeah.
kind of rough on the body.
Yeah, they have a couple of chiropractors, but we have a couple that come in because the waits are long. With the body contouring, we see a lot of them because they have a procedure called taping,
Yep.
and where they have
Right around PT test time.
so they're looking for a quick fix on their taping. So we see a few of those as well. Usually we do 2 treatments a week for 4 weeks. It's usually a typical treatment plan. They sometimes want 3 or 4 treatments in a week, in 2 weeks, so. And we usually can accommodate that. We want to, because they exercise so much, they're able to break down the fat, and so we can probably modify a typical treatment plan. Any other questions? Everybody's waiting for your results.
Jump up and run out here.
I actually have I have 5 more books. Would anybody like a book? You would like a book? Okay.
Can you do that treatment on your feet? Like I run.
Yes.
Well, I stopped running because I had like burning, the ball of my feet burned. And I don't know what that, not that I'm more to the doctors or anything, but do you think the laser would?
Laser, I've used the laser on a lot of patients with feet pain, whether it be plantar fasciitis, and we do a couple other things with that as well. A little bit of soft tissue work.
Do you need to have like a true diagnosis of like what it really is?
I come up with my own diagnosis.
Okay.
Able to do that.
Okay.
But chapter 4, if you have a book, and if you don't have a book, stop by my clinic. I have business cards and things like that. I'm right down the street, half a mile on the end of Fort Bragg Road. And stop by and get a book, and I'll give you a book. Chapter 4 is on the laser therapy for pain. Chapter 5 is that disc treatments, the disc decompression. And I have a chapter on rehabilitation and a couple other things.
So on the back stuff, so are any of your services covered by insurance?
Yes.
Okay. Is back stuff?
Chiropractic, sometimes acupuncture, it's basically by plan.
And what are your hours?
Mondays and Thursdays, I'm there nearly all day. I need to go get my daughter, 2 o'clock here time frame. That's end of treatment.
All right.
Go ahead and stand up and see how,
All right.
and
That's the hardest part, is getting up and down.
how'd that feel?
That feels pretty good. There's
Very
only
good.
one little twinge.
One little area?
But it's worse sitting down, so I'm gonna.
Okay, go ahead and sit
Yeah.
down.
I'm not allowed to get on the bike anymore. I'm not supposed to get on my knees anymore. Thank you very much.
You're welcome.
The only exercise I'm allowed to do is in water, so
Okay.
it's pretty severe because I'm a candidate for knee replacement, which I want to avoid. So here's the test.
We have one last
Nothing.
question.
Didn't feel anything.
Didn't feel anything?
Usually I do.
I'll pay the
something.
fee in a moment.
Okay.
We have time for one last question.
One last question.
What can we do as community to help you?
Well, community to help me. Really, the only thing I ask is to help me educate on this new laser therapy clinic. This therapy is not well known in the community, and I'm looking for patients that are in a lot of pain. Want to get some patients ready for the beach. We have many of our patients have just a couple little trouble areas that they have difficulty with their fat with or pain. We help that as well. So laser therapy is a growing field across the country. Here in Fayetteville, there's not much promotion. Women's View magazine did a feature on the iLipo this month, which was very nice of them. And, you know, so if you're able to tell others about, you know, the laser therapy, that would be great.
Thank you.
Thank you.